Good afternoon. Since Thursday, April the 9th, we have seen a 51% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 962 reported cases, 217 people hospitalized with COVID-19, and 29 deaths. We remain committed to scaling up our response to this emergency while continuing to leverage the wealth of medical and public health expertise here in Baltimore. Building from the announcement made last week about the public-private partnership, which is committed to supporting our community, I have a few updates that offer more information about the program and what it means for our residents. Last week, we launched our dashboard to provide residents with essential information. To help keep residents informed as we progress through this national emergency. And after the state released racial demographics data, we have incorporated that information into the dashboard. This operation is critical in supporting people from the safety of their homes. We cannot stress this enough. Avoid hospitals and healthcare facilities when possible can save lives. And we are asking your help in minimizing your contact with hospitals, healthcare facilities during this time. Baltimore, we have seen progress in flattening the curve, but this is no time to rest or let up. Everyone needs to stay home, unless you are going out for an essential reason. Every time you leave your house, you put yourself and everyone in your household at risk. Now I will ask Baltimore City Health Commissioner Letitia Zarasa to update you on our COVID response and our work to support the residents of Baltimore.
Good afternoon. Thank you, Mayor Young, for your leadership, and thanks to my colleagues and our partners for their support. This afternoon, I will be providing some updates related to the Pimlico testing site, as well as discuss our progress for other community-based testing sites, our introduction of racial demographic breakdowns in our case tracker, and updates related to 211. As Mayor Young announced last week, Baltimore City opened its first expanded testing facility at the Pimlico racetrack on Friday. This was made possible by the support of LifeBridge Health, the National Guard, and the Stronach Group. On its first day, 96 people were tested for COVID-19. Yesterday, we had to temporarily suspend operations due to inclement weather. However, today, 115 people are scheduled to be tested. While it will take a few days for us to receive the test results, we are encouraged by the presence of these community-based testing sites as a way to expand access to testing for Baltimore City residents. I want to reiterate that at this time, the Pimlico testing site is by appointment only and requires the referral of a clinician. Additionally, the Pimlico testing site is only set up for drive-through testing. Last week, the Maryland Department of Health released demographic information of confirmed COVID-19 cases statewide. Baltimore City is using this information in our local COVID-19 case count dashboard, available on our website, coronavirus.baltimorecity.gov. The data provided in this tracker is updated daily once the latest figures and case counts are available from the state. I would also like to note that while we receive demographic data from the state, if there are between 1 and 5 cases in a given demographic, to protect the confidentiality of patients, we will not be posting that information to the dashboard. Based on the current available race data, we now know that African Americans make up the majority of cases of COVID-19. We also know that there is a higher rate of fatality in African Americans than in other populations in our state. While it will take some time to examine exactly why this seems to be the case, there are concrete steps that the Baltimore City Health Department and the City of Baltimore as a whole are taking to address this disparity. The first is to improve our messaging around the coronavirus. Unfortunately, there is a persistent rumor that African Americans are immune to coronavirus. This is false, and the data shows that this is a very dangerous belief. In order to tackle those rumors, we are expanding our messaging beyond social media and traditional ad buys to reach African Americans where they are in Baltimore City. The Baltimore City Joint Information Center is actively developing novel outreach strategies. In the days to come, we will be deploying culturally relevant signage in places we know residents may still be physically congregating and not social distancing, places such as bus stops, corner stores, and other hotspots across the city. One of the most important things that all residents, regardless of ethnicity, can do to slow the spread of the disease is to abide by social distancing, and the city is doing its part to ensure that all residents see this message everywhere they go. We also know that transportation and access to personal vehicles is not available to all residents in Baltimore. With the release of racial demographic data by the Maryland Department of Health, we also know that 21215 zip code, where the Pimlico testing site is located, has the highest concentration of coronavirus cases in the Baltimore region. Moving forward, we will be analyzing demographic data to determine where the next community-based testing sites should be. Our goal will be to ensure that all residents, especially those without access to a car, can receive testing in their local community. We are actively scouting potential sites on both the east and west side of the city to support populations in need. We will share more information with Baltimore residents about any additional locations once they have been finalized. Finally, I would like to reiterate that Baltimore has launched the city's 211 hotline, and they have been provided scripts and information by the Baltimore City Health Department to serve as a line for medical support from the safety of your home. Residents should call 211 if they have any symptoms of COVID-19, including cough, fever greater than 100.4, and shortness of breath. While 211 is not a replacement for your primary care physician, nor should it be used by residents experiencing severe symptoms that require immediate medical attention, 211 is a great resource for those who have questions about coronavirus. Even if you don't have insurance or a primary care physician, you can call 211 to receive further information about what next steps might be if you're experiencing mild symptoms or have general questions. Thank you all, and please continue to practice social distancing and stay home except for essential purposes.
Thank you, Dr. Sarasa, for your commitment to the city and its residents, and to all the employees at the Baltimore City Health Department working around the clock to keep us safe, and all of our city employees who have come to work to help us during this pandemic. We will now take a few questions. I'm going to let my HR director, where is he, come and address that. I know that we've been working with our county executives around the state. Some have implemented, like Prince George County. It was in Montgomery County, said they were going to do something by Wednesday, but we want to have our HR director speak to that.
Yes, we're currently working with our health commissioner and the attorneys in our occupational health division of the law department in developing guidance for our employees around face coverings in the workplace.
We're looking into face covering. We know that some citizens cannot afford to go out and buy a mask, and we can't provide it to every citizen in Baltimore. So what we're looking at is to get a policy that would say face covering while you're in public. Just yesterday I spoke with MTA about the bus and how crowded the bus was with all those people on the bus. And I thought that, that was something that should not have happened. They cut back on some of the service, and I think they're going to at least have 10 people riding on the MTA buses, because we are serious about slowing the curve, and we don't want to have people riding on the bus all crammed up, on the bus, elbow to elbow. So we're looking at that, and I'm quite sure we would have an announcement by Friday on how we're going to address that.
Two questions now. Is it even feasible?
You got to take that off. I can't.
Is it even feasible or possible for everybody in Baltimore to have a mask or covering? And then the second question, I've been getting a lot of complaints with people taking these off, the masks off, and just chucking them on the ground.
I've seen a lot of people throw them on the ground. On the ground down the street there. They just, I don't know. Even if we tell people that they have to cover their face, you're gonna have people that's not gonna do it. So as much as we want people to abide by what we are telling them, according to what the CDC is saying, and the Maryland State Department of Health and Mental Hygiene, and our own director of our health department, we can only tell people. There's no stick to make them do it, but we're hoping that they will follow the guidelines that we set forth and abide by what we ask them to do, so we can slow the curve.
Is there anything else?
Can we ask the health commissioner a question? Dr. Ross? Do you have testing numbers for city residents? In other words, we know confirmed cases per zip code. Do you have a sense of how many people or city residents have been tested?
So I will say the state data shows that about 12% of all those tested are positive. So we could do kind of the back of the napkin math, but I would have to defer to the state, who would have much more comprehensive data on all the testing occurring across the city.
Okay, then the other question, which is probably also an extrapolation, we know this term, patients under investigation, PUIs. Any idea? Because so we have this positive number, but we don't know how many tests are being administered to know how close that is to a real number of spread. But do you have a number of any sense of how many patients are under investigation?
So on average, with our contact investigations, we tend to identify about 6 close contacts. So again, it be back of the napkin math to understand who might be under investigation. But again, I would say that not every person who's been exposed is necessarily tested if they're not symptomatic. We still follow the criteria around eligibility for who gets priority around testing.
Thank you.
Health commissioner? I'm just wondering if you have any better idea about what you applied to zip code.
So, again, I think that's data we're still looking at. Certainly, there was availability of testing prior to Pimlico that was being performed by LifeBridge, so it could have something to do with access to testing. But I think we're still, still early in obtaining the data.